So welcome everybody to another New York Theological Seminary webinar with Dr. Lydell, Lettsome and company, right? We have a group of experts today, and we will continue to do these updates for our community, to inform our community and to help encourage and sustain our community. I know for everybody, all of us from New York, especially this week, it's just been brutal. The number of people who have who have it and who have succumbed is just, yeah, this week particularly is being especially harsh. Last week I think we shared that Bishop Alfred Johnson's wife, Jerry Johnson, passed away last weekend. And then this week, one of our staff's mother on Tuesday, Dr. Gina Green's mother, passed away also, coronavirus. And then just so many of our professors, their church members have either passed away or are with a respirator now. And I know Dr. Lettsome told us, I think in one of our first webinars, you said that when all this was said and done, we would all know somebody who passed away from this. And I keep thinking of that, right? When you said it was such a shock to me, it makes sense, but it was also shocking to me to hear that. And we are not even at the peak of it. And it's already at least 6 people, one of whom I knew well, but at least 1 degree removed from me, who have succumbed, who should be alive today if it wasn't for coronavirus, right? They had, you know, other health issues, but they were fine. It wasn't yeah, they should be here today had it not been for coronavirus. So yeah, this week especially, at least for me and many of us at New York Theological Seminary, has been a hard week. So with that, I'll turn it over to you, Dr. Lettsome.
Well, thank you, Tony. Good afternoon, everyone. Today, a couple things really is I'm not going to go into too many hard numbers because we kind of did that before. And I think the country as a whole is starting to grasp the gravity of the numbers. I do want to touch on some issues where I think there's larger public confusion and how it affects the church as well. So some of the things we'll talk about is definitely the testing aspect, and even some of the therapies. What is the big hubbub about the PPEs? Some mental health issues, and how do we find hope? Because we can't let this overtake us, but we have to find constructive ways to go through this, and then share some resources that I've been able to find and hope that will also be of benefit to people. Before I move on though, I just want to say a quick prayer, okay?
Yes, please.
Gracious God, we thank you for this opportunity to come together as a community. We come before you, Lord, because we acknowledge that in the midst of all this, you are still in control. So God, we come before you seeking guidance, wisdom, affirmation, and remembrance that when all this is said and done, that we must look for the good in it, look for the purpose and cause of it, but also look, God, at what should we be doing next. That this is not a time to figure out what is wrong and to give up hope. This is not the time to try and blame. This is not the time to run and hide, but this is the time to test our faith, to test your power, to test your ability to bring all of us through. So God, we ask that you would just give us the wisdom and the foresight to not only just talk about what has happened, but to figure out what to do next. In Jesus' name we pray, amen.
Amen. Amen.
So, okay, now what's going on? There we go. So the next update problem is that finally our president is starting to acknowledge that this is serious. And the last press conference of his that I listened to was acknowledging that it'll be a success if we keep this under 100,000 deaths. And one of the panel talking about that it is not far-fetched to approach 200,000 deaths. So that's real and painfully scary, but unfortunately very possible. And one of the reasons is why that's possible is testing is still not readily available. I'm actually supposed to review with some people tomorrow a testing kit that hopefully will be able to provide a result almost immediately, almost like a home pregnancy test, which, you know, has some capabilities and implications in terms of a lot of things. So why do I keep harping about testing not readily being available in every talk? Is because testing is really key for us to epidemiologically understand what is happening to us right now. Right now, we're guessing in the dark because we don't know who has it from who doesn't has it. And it's not about trying to stigmatize people or to create a false sense of panic, but testing helps you understand, well, what are the risk factors? What are the type of populations that got it? Are there any predictable behaviors? All these things will help us mitigate spread. Testing also helps in terms of research because these are viruses, so they work on how much of it is in your blood level. Just in the same way, if you understand how HIV works, then you can understand how this works. It's not just, do you have the COVID virus, but do you have enough of it to cause symptoms, or do you have enough of it to give immunity, just as also with hepatitis? All this thing matters, but you don't have that information if you're not testing people. And it just means that we are guessing, and that's not what you want to do. That's not what we go to school for. That's not what we claim ourselves to be the best country in the world for, is to be guessing at stuff when we can get answers. So anywhere you have a conversation to push for testing, if you know people who have control over testing, the best thing the United States of America need is universal testing. Universal testing. Universal testing also has an economic impact because guess what? You start testing people, start testing them reliably, start finding out who has immune to this, who's already battled it. Those are people who can go back to work. There's real value to this. Moving on, the mortality of COVID-19 is higher. When I did my first talk, I made it a point to say that it was low because I wanted people to realize, yeah, the overwhelming majority of anyone who gets this is going to live from it. But as the week progressed and I saw how many people just misread that statement as, oh, I'm fine and this is no big deal. Yeah, that's not what I was saying that for. I was saying it to know that just because someone gets it, I don't want you to go down a lane of panic like, oh my God, the end is near. But the reality is, this virus, and why the healthcare community around the world is so concerned, because it is more lethal than the average flu, like on factors of 10 and 20. So it's not going to kill more than 3% so far of its victims, but compare that to the flu, which is less than 1%. And we still worry about how many people die from the flu every year. So keeping people from not getting this is real, because if someone gets it, it is still a significantly higher chance of them passing away than any other virus we've dealt with in the recent past. The other thing we have to bear in mind is caregivers are getting ill. So when you're seeing some of these things in social media and you're seeing people sending out emails and stuff like that and pushing and begging for you to stay home and be very careful what you're doing, because caregivers are getting ill. Critical care nurses, critical care doctors, ER doctors are getting ill. Several of them on ventilators right now. Not all of them are surviving this. Unfortunately, a few have passed. Like, just as you said, Tony, people who should be here are not going to be here. And something to just consider, you're talking a valuable resource. The amount of years, money, and effort to make one ER doctor, to make one pulmonologist, lost over a virus that we can prevent and control if we all start doing the proper behaviors. Okay, yes, Washington may not be saying it the way we want to be saying it, but we're adults. We've got to put on our thinking caps here and stop taking unnecessary risks. There is still no cure for COVID-19. Please stop assuming that. Please stop spreading that. Please stop trying to post issues out there like, hey, most of us, there's no cure for this. And the treatment timeline of it is extensive. It's not, oh, we're just going to give you this for a couple days and you're better. That's the majority. But there's still a real percentage where a month of their life is caught up in their treatment. The majority of the people on the ventilator, these are 2-3 weeks of fevers, temperatures, sedation. That's not what we want for our citizens. That's not what we want for our moms, dads, aunts, and uncles. And then family and visitors can't see people. So we really, as a community, have to take this seriously. As faith leaders, one of the ways we can have faith is having faith in our medical system and telling our practitioners, hey, now is not the time, telling our, not our practitioners, telling our laity, now is not the time to be taking unnecessary risks. All the therapy out there is still experimental. Yes, they're having some success with it, but the last things I've been able to get from the infectious disease doctors and pulmonologists who I've been talking to, it is still touch and go. It is not guaranteed. So just because they have the Plaquenil or the zithromycin doesn't mean you're gonna walk away from this. The people who have passed away, several of them got Plaquenil. Several of them got antivirals. Several of them got antibodies. It still didn't save them. The best thing we have, everyone, and I know this is frustrating, trust me, is affecting everybody. But physical distancing is the best treatment we have right now. To try and think of something else, you're lying to yourself. I know it's hard not having normal church services. I know it's hard not shaking hands and passing the peace. We just missed communion. We got Palm Sunday in a few. It's frustrating. This is the time of the year that we are supposed to be living our best life in the Christian experience of why we are saved, because Jesus rose. But we're gonna have to find a different way to share that joy and acknowledge that joy. We just have to. PPEs, the personal protection equipment. Let me see, I want to see since I can make this in a way that fits non-clinical people. In medicine, we have something that came out of the HIV epidemic of universal precautions. And the ideology of universal precaution is that you treat everyone as contagious to avoid stigmatizing people, to avoid unnecessary biases and judgment. Universal precautions, the ideology of it is you treat everyone as contagious. That is actually what started all of it. Not, oh, I need to protect myself. It was you treat everyone as that they possibly have the disease or they have a disease. And out of that bore all of the washing of hands, all of the nitrile gloves. I know this is hard to believe, but for those of you who are older than me or my age, you can remember a time where doctors just walked in the room, nurses walked in the room, they washed their hands and they started touching people. It was the HIV epidemic that stopped all of that and said, hey, we got to treat everyone as they are contagious, and everyone being that contagious is also the medical professional being contagious. So the PPEs, the personal protection equipment, carries pathogens. So out of that ideology that even the medical professional, the medical caregiver can be the one who's contagious, meant that you didn't wear a mask in different rooms, meant that you didn't wear the same gown in different rooms. There was no such thing as wiping off gowns and wiping off gloves. And I mean, that's since the beginning of this year. I'm a surgeon by trade. So what does that mean? Surgeons, we would get fussed at. Where are you going with those shoe covers? We're not allowed to walk around the hospital with shoe covers. Who cares how clean they were? And it's like, hey, that's carrying stuff around the hospital needlessly. Not allowed to walk around the hospital with the same mask. So I remove someone's gallbladder, my mask is clean. Okay, but I couldn't just walk across the first floor, third floor of a hospital with that mask on my face, someone would immediately write me up for breaking infection control precautions. But now all of a sudden we're watching videos and just all kinds of nonsense where we're seeing doctors and nurses wipe off gowns. That is not normal. I can't stress it to you enough. There is nothing normal about that. We are watching doctors and nurses being forced to do things that as recent as December would have gotten them fired on the spot. On the spot. An administrator watching you walk around the hospital like that and would want to know, who is this person? Because if the Joint Commissioner of the Department of Health came in the hospital and saw this person walking around here dressed like that, we would get cited. So please, without trying to get too political, be clear. What you're seeing and being told is not normal. And that's why you're seeing in certain institutions, nurses and healthcare workers protesting, because we are not doing what we normally are trained to do. This lack of personal protection equipment increases the risk of transmission. The things that healthcare workers are being told to do in this is compromising care. It's not improving it, it's compromising it. And it's supposed to be the wealthiest, the biggest, baddest, and best country in the world. We should not be asking our healthcare workers, our law enforcement workers, our first responders to go around doing stuff that only 4 months ago we knew was not safe. Moving on. Mental health. This is taxing to anyone. Cooped up in our homes, not knowing when we're going to be able to go out, movie theaters closed, churches closed, hair salons and barbershops closed, can't find toilet paper when you need it. You know, certain states, if you drink, can't even find the alcohol. Like all of the things that we normally do to keep ourselves sane, we can't do. And I'm saying that because in this process, as you look to keep yourself sane, one of the things you have to accept that your anxiety and your fears are reasonable. They're reasonable. And so you, just like anyone fighting alcoholism, anything else, starting off the fact that my feeling out of sorts, my worry is the first step towards you managing it properly. If you're trying to go through this like none of this is affecting me, I'm living my best life right now, that's denial, which in of itself is a mental health issue. So I'm not asking you, and nor is anyone expecting you to deny your fears or your concerns. What we are saying is you've got to work on creating a new and healthy normal as we wait for this to pass. I'm stressing this because yes, there's mental health stuff out there, and mental health is being included in some of the stimulus bills, but also from my mental health colleagues, and we're hoping to have one to actually speak to you all today. But that whole process in itself is changing. So what I mean by that, hospitals and mental health units are not admitting anyone unless they're having a real psychotic break. So pretty much all of this being available is telehealth, and you reaching a crisis center and having someone talk to you. Once again, if you've never engaged them before, highly unlikely they're going to give you any meds, highly unlikely they're going to do anything aggressive. So the more you are able to create a healthy normal, create your own meditative practices, create your own reassuring practices, is going to be the best thing for you. And as Christians, first that starts off with having a deeper connect with God. Going back to spending more time, as we talked about last week, if you can't find 15 minutes now to spend in time in prayer and meditating on a scripture, writing about a scripture, you don't have to be a pastor to do this. This is for everyone, from pastors and preachers. Find time in the word to ground yourself, to remind yourself that you were created, you weren't just born, to find out what is your life purpose with God, to find out what am I going to do when this is over. Because the majority of us, thankfully, will survive this. But what are we going to do after this is over? Connecting and reconnecting with people. Stop texting, pick up the phone, call someone. All right. Stop sending the messenger stuff. All that's great. Pick up the phone and call someone. And family and friends, as we are picking up the phone and calling each other, we got to step out of our comfort zone and go away from just the simple, how are you doing, connect questions. What did you watch, Tiger, or Little, whatever it is on Netflix? No, this is the one where you got to ask people some harder, deeper questions. How did you sleep last night? What are you eating? Are you exercising? Did you pray it all today? Do you want us to pray together? We got to connect on deeper levels on the phone. Just checking in with people and sharing a few jokes is great, but got to connect with people. One of the ironic things about suicide is people who commit suicide often has spoke to someone within hours of it. That's an awkward reality. So not just conversations, but real conversations, caring conversations, compassionate conversations, asking people how they're doing financially. If you have something to spare, you might have to spare it. Asking people that they get food. And also in this new healthy normal, particularly if we're depending on where you live, this might be your chance to find something else useful to do, because there are a few religious and not-for-profit groups who need people to deliver food, who need people to deliver items and resources. So this is where you can find something else to do. They need people to make the phone calls to check in on their senior citizens and their shut-ins. You can join on that list of who makes those phone calls. All right? That healthy normal. Stop sleeping in. Get up. Okay? He's like, all right. For the parents who are homeschooling, homeschooling doesn't have to be all day. My wife and I looked up a lot of homeschooling resources. Lo and behold, people who are doing it a long time said it's fine to do 4 hours. Don't have to do it all day. To find some time in the afternoon or however you do it morning where you actually maybe just playing with your kids. One beautiful meme that was sent to me a week and a half ago was, just a year from now, we're going to be talking about, as much as parents are worrying about how we're going to pay our bills, am I going to get a check from my job? Do I have to apply for unemployment, which is hitting 10 million people? How are we going to do our church services? While all of that's going through our heads, our kids are going to be like, man, remember all that time that mommy and daddy was with us? Remember all the time we ate together as a family? Remember all those family movie nights? Remember all the time we prayed together as a family? And even from the adult level, man, I hadn't spoke to my college classmate in 10 years. Now I talk to him or her every other day. There is time to create a new healthy normal during this experience. It's not the time to be getting bitter, angry, fussing about what's happening in Washington, fussing. That is all real, but you cannot let that define this experience for you. So how do we find hope? The first thing is understanding that this will end. And clinically, and I'll try to explain that better, but clinically, most of this is going to be over for all of us by the time we get through June. And what I mean by clinically, the majority of the hospitals being taxed, the majority of the deaths will have come through by the time we hit June. And I know this may sound callous, but the best analogy I can give is what I would share to my cancer patients. And I would say to them, like, look, your life is going to be changed for the next 18 months to 24 months in ways you will never, just can't prepare for. But the reality of it is, depending on what stage they're at, when you get through these 18 months, a lot of stuff is going to go back to normal. And you have to prepare for what that normal is going to look like. You're going to see a lot of doctors, you're going to see a lot of nurses, get a lot of medications, but there is a normal at the end of this. For us as Americans and clergy, this is 4 months of chemotherapy. But after that, things get back to normal. And if in terms of diseases, we know 97% of us are going to survive this. So your church congregation is still going to be about the same number of people after this that you had before. Most of us are going to physically be okay. So you're still going to be able to work and do your job. You're still going to be able to exercise. You're still going to be able to plan some vacations. Like, things will definitely change, but we have to bear in mind how that change is going to look. As you think about that, one of the things I want to share is there will be work to do. Different parts of society will have fallen apart and are going to have to build and repair. Hospitals are going to have to disinfect themselves. Hospitals are going to have to deal with staff members no longer being there. Churches are going to have to deal with members no longer being there. Family units are going to be broken because funerals won't have taken place in the way that we normally have funerals. So there's going to be repairing that needs to be done. As Christians, how are we preparing ourselves to be part of that repair process? How are we preparing our congregations to go out into our local communities to be part of the repair process that our communities are going to need? This is a time of opportunity for us, because when this is done, there's going to be a new normal. And the better we prepare for that new normal, the better we can get things to be the way we want it to be. And I don't want to tip my hand, but the majority of next week's talk is going to be about what is your new normal. As a surgeon, one of my new normals is going to be further arguing for universal health care, getting into probably some very heated and blatant conversations with my colleagues as surgeons. A lot of surgeons, we don't need this stuff. We don't need universal health care. That's just a way for the government to control our business. That's just a way for them to take our money. Well, guess what? Now, most ORs around the country are closed. And surgeons in private practice, we've lost 90% of our income. We can't do anything unless it's an emergency. So yes, we can go in the ERs and the ICUs and help, but that's volunteering. At the end of the day, after that's done, the thing that keeps us paying our bills is operating on people. We can't do that. You're not hearing it on the news, but doctors' offices are furloughing their employees because they're not bringing in any money. Universal health care would have changed all of that. So what are we going to do when this is over with so that we as a society never break down like this again? We'll have a pandemic, sure, but how do we prepare for the next pandemic? We don't have 10 million people filing for unemployment in 1 month. How do we prepare for that? How do we prepare for parents having to homeschool their children? Like, these are things that are necessary. We've seen it can happen to us. How do we prepare for what that new normal looks like? This is the time to start doing it. This is the time to put in your work. This is the time to go and do things that you quote unquote didn't have time to do before, to write your book, to go and do your Udemy class, to learn how to cook something new, to finally go and clean out your garage. One of my friends went and made a whole new pond in his backyard. The guy's a chef. He just started watching YouTube videos and was like, hey, I'm going to do this. It's done today. Like, don't let this make you stop living your life. Yes, you can't live it the way you was living it in January, but you can still live your life. And when we are allowed to go back to physically connecting with each other, we need to be prepared on how are we going to connect as a church? How are we going to connect as a people? Because I can't avoid it. We're living this out because of conservative political ideologies. And the conservatives have for 25 years managed to swallow their differences and stick to a common agenda. And because of that, almost nothing can get done in America without conservative politicians approving it. How are we on the liberal side, both in the church and without, going to stop bickering over our differences and adapt to some universal principle where we are no longer being pushed around by conservatives? Like, We're facing this, not being able to get ventilators, not having universal health care, watching corporations get more money than people is conservative ideology. How long are we going to waste our breath arguing about whether or not women can preach? Gays are going to get into heaven. You've never been to heaven. You have no idea who's going to be there. Why are we wasting our time arguing over this stuff? Our country's falling apart, and we're holding Baptist, AME, UCC conventions arguing about stuff that's not going to save our country. We got to have a new normal after this is done. We owe it to ourselves. We owe it to our children. We have to have a better plan than what we've been living under.
Yeah, this is part of what I was, we had a little bit of this conversation last week, right? About the role of religious people and our civic responsibility, right? I think for the last, because of that conservative ideals and the inward turning of our faith, right? The myth that we could separate religion and public life, that we outsource our civic responsibility as Christians a lot, right? And less so in the Black church, of course, has a long tradition of civic involvement, but overall, and especially with younger Christians, unfortunately, right, they've lost that sense of the civic responsibility that we have a responsibility for everybody, right? That this as part of citizens, we have to work towards a common good, right? We have to contribute to build the common good, and I think that's a very dangerous thing to have lost in the last 30 years or so in America,
especially when another group hasn't.
Mm-hmm.
It's like that's reality.
Well, I think the other group have lost it, and they're using it for their selfish, for their tribe, right? And that is not towards the common good. It's not
exactly.
The civic good that, because remember, we're old enough when we could remember, no matter who won, right? That was the president, right? He was a president, right? Whoever won, whoever you voted for, if that person won, he was a president. Now, I think since I've been old enough to vote in America, I wasn't always a citizen, so I couldn't always vote. But since I turned 18, I started paying attention to elections in the U.S. Every president has been delegitimized by some group, right? Starting with Clinton, right? As in, this is not a legitimate president. And I think that culture has seeped in deep enough that even those of us who are very civically involved and believe in the democratic process have a very hard time right now to say that, American democracy has worked, and what we see right now, right, is supposed to be the way it was, right? It was supposed to be, right? So, I think that's, I think if anybody's going to help us recover the sense of the common good, it has to be the church, because we have our very existence is for the sake of others, right? The church was never supposed to be for ourselves. We were never supposed to exist for ourselves. It was for the sake of others.
No, you've said it. And I just think as we move together after this, I just think and like I said, I'll definitely go into it in more organized fashion in our next talk, but there's just things that we individually and then communally need to prepare for and plan for. How do we engage afterwards? Because we're seeing how things can go if you just let certain practices continue.
Yeah.
And the simplest ideology I can think of is medically the whole anti-vaxxing movement, and minorities definitely have legitimate concerns in terms of trusting the healthcare community, but it's out there. People are putting out like, you're now experiencing the world because we don't have one vaccine. Like it's, everything's not always how you want it to be, but that doesn't mean you throw it all out.
Yeah.
And so we really have to this is showing like we have to come together differently as a community after this. Um, we still must maintain our self-care, still maintain the proper hygiene, still get rest, eat healthy. Yes, I know all that Grubhub food is out there, but still don't lose track of fruits and vegetables and proteins. Pace yourself, pray, meditate. Yeah, like this is the time to Google prayer practices and find one that works for you. See how much more time you can increase in your prayer closet. It's like this is the time to work on it. Lastly, some things I want to share, and I'm going to do it differently because I couldn't really get the links to work. So just give me a second, everyone. One I want to share is an email from Samuel DeWitt Proctor. They posted on their website do I have it right? They posted on their website a great PowerPoint presentation on how the benefits break down for churches for the stimulus package, how you can pay your employees and people. And so please go to their website and check it out. So as opposed to me trying to recreate everything, just let me see if here it is. They have the link to the webinar. Let me see if my link will work for you guys right here. And good. So you can see like the slides are all here. Really nice presentation. They actually gave it yesterday, I believe, but talks about how you can use the loans, how large they can be. So if you're pastoring and wondering like how do you find money for your congregation and your staff members, please go to their page because it's a great breakdown of it. Okay. And then one of my
NYTS will try to help as much as we can with this. We are looking into this. As a seminary, we'll probably be applying for some of that, the payroll protection and some of the higher education grants they have.
Exactly. And then one of my friends, Reverend Melvin Wilson, you guys know him. He's a great source of all kinds of information. Was able to get to me taking care of your behavioral health. And I was hoping that it would have a little bit more mental relaxation practices in there, but it just does go in there to like the anxiety expectations, how do you support yourself, educating yourself, but also what you should be talking to your doctors about, and some resources. The resources vary through state and county, but they're out there. So first thing to start with, if you don't have it in your church and your church doesn't have a relationship, go to your state or your county's Department of Health webpage. Pretty much all of them right now have crisis hotlines on their webpage, and call that crisis hotline to start with, because you're not really just going to be able to walk into a therapist's office. So unfortunately, if you haven't been in therapy before, your entry to it, if you feel you're needing it during this moment, besides praying with fellow church members, is probably going to have to start with a crisis hotline.
Yeah.
Okay.
Yeah.
Those were the two biggest one I really wanted to share. Don't want to overload. And thank you all. Physical distancing is treatment. Please remember that. And if there are any questions, you take them.
Ms. Costello wanted to speak.
Hi, my name is Reverend Dr. Costello, and I am a chaplain and director of community engagement at Mount Sinai. So I'm so glad you're doing this. There's some of us who are engaged in patient care and providing spiritual care in a hospital setting do not have time, although we think about these questions, we just don't have the time to engage this sort of discussion. So I think there has to be kind of like two layers of, or multiple layers of how we're approaching these questions, and even already, planning for the future. But if we're working with patients, the patients are facing life and death situations. And I just was talking to a woman who did a Spanish speaking, who did not understand how her husband could share a vent. So as well as providing spiritual solace for patients and families, that we're also doing things that normally a medical staff would do, but the medical staff is so busy, they don't have time to have these conversations, with the patients. So I just, I appreciate this opportunity. It gives me more of a sense to be in community with people who are thinking about these questions, while at the same time knowing that all of the boots on the ground are so busy and so engrossed in trying to provide care on multiple levels, whether it's in a church, in a hospital, in a community-based setting. And people are scared, they're crying, they're wailing. This is a time of wailing in our faith communities of all religions. And just being mindful of that, and helping to lift up our spirits, and even having this kind of future future conversation, is hopeful, because we know that there are things that we have to do. We've been locked in because of a system, but we don't have to continue to cow down to that system. We can band together, and use our voices. So thank you so much.
Absolutely. Yes.
And thank you for what you're doing. And so you're hearing it from someone else. It's overload. A lot of stuff is not being said about what's happening in the hospitals. So it's real, and we have to prepare for how we're going to comfort. And I know from the pastoral standpoint of wondering how you're going to keep the church doors open. And I was sharing with one of the nurses, because the question of that there's space in the stimulus package for churches, and there's like, as churches. And I said, well, churches have staff. Who cares if it's 10 or 20 people? They have staff, and these staff members right now are definitely facing not getting paid what they normally get paid. So so I know that's real. I want pastors who are listening to don't think I'm dismissing that, but there's ways you can find to continue your ministry, because people need to be hearing from us. So in addition to worrying about how you're going to do your audio sermon, and a lot of pastors are doing it, but just still the time is like, do you start splitting up between your ministerial staff list of who you're going to call every day? I don't mean like Sunday through Saturday, but you can pick 4 days a week, particularly if you're a full-time pastor, 15 people you're going to call and personally check in on. Give your associate pastor another 15, give your youth pastor another 15. Like, that is ministry. I know some of our churches have gotten so big and corporate, we don't tend to do that anymore, but that's still real ministry. And, and reaching out to each other, because it's really frustrating to be going through something and then to think you're going through it alone. So this is the time to make a new clergy friend. And I've been seeing some things of people talking about ecumenical worship for Palm Sunday and Easter weekend. I'm excited about that. And I hope pastors and laity will do it beyond their normal practices. I hope if they do that, they won't just reach out to their, I'm Baptist. I hope they won't reach out to their normal Baptist friends alone. That they might reach out to the person who's the Adventist pastor, or the person who's the Catholic pastor as well. And there's only one heaven, like no matter what we believe, there's only one heaven. And communities, believe it or not, for the most part, consist of multiple denominations. So let's say you're doing something creative in terms of asking your parishioners to, at 1 o'clock on this Palm Sunday, to wherever they are, gather as a family, hopefully outside or inside on the lawn, the back, but to sing because he lives or something like that. Why not have the other churches around you agree to do that? What would that look like in America, that 1 o'clock Eastern Standard Time this Sunday, you're seeing Seventh-day Adventists, Baptists, Catholics, Lutherans on their front lawns, back porches, whatever, out their windows, as they were doing in Italy a few weeks ago, singing a Christian hymn.
Mm-hmm.
That will send a pleasing aroma up to God.
Yeah.
Like we have to, we got to be creative and find ways to really take this opportunity to change the way we live in our communities as
Mm-hmm.
Christians.
Absolutely.
To people doing the church without walls, this is our time to really start building some amazing churches without walls.
Mm-hmm. Yeah. Well, thank you. For those of you who haven't given us your email, please you can put it over there in the chat or email us. You can email it to me, tlin@nyts.edu, so we can add you to the mailing list for these webinars. But also, as we move forward with this, right, especially what Dr. Lettsome was talking about, the rebuilding part, right, life after. I think we are at a moment where those who are first to imagine the future get to own it, right? Because
Yeah,
nobody knows. Nobody knows what life after is going to look like. And here we are, we're meeting every week. We're talking about this. We're all people of faith. We're all people of hope, right? So why not us? Why not us? Why not this community at New York Theological Seminary, right? Why not us? Why don't we get to say what life after looks like, right? And so if you give us your emails, we'll put you in our mailing list. And as we begin these conversations, not all of it will be private, right? But we'd like to invite you into those conversations to say, hey, based on what you're doing in hospitals, based on what you're doing in schools, in your communities, right? What do you think? What do you think it's going to be like to parent, to be a husband, to be a wife, to care for your aging parents, to care for your kids, to be a good citizen, right? What is that going to look like? And if we can come together and publish some type of statement, create some type of, maybe even a podcast or a video vlog series, right? I think we can make a good contribution to the cause of the church together.
exactly.
Yeah. So yeah, send us your email so we can put you on the list and you can be part of this community as we try to figure out a way forward. So thanks again, Dr. Lettsome. Thank you so much for your time. I always learn something new. I always feel a sense of dread, but also hopeful every time you present. So you have that magic touch. Oh no! Okay.
Yeah, I was talking to one of my, you kind of alluded to at the beginning. It was like, one of my friends said to me, so how does it feel to be right? And I was like, not good at all. Like not good at all.
Yeah. And like Reverend Costello is saying, we will be doing this in different languages. Yo hablo español, no sé si vos hablas español.
Sí, señor, yo hablo español bastante.
Bueno, la próxima lo hacemos en español. Tenemos muchos profesores que también hablan español, así que sí. But yeah, we will be doing this in different languages. So that's, I don't know if you know Humberto Alfaro, Dr. Alfaro. I talked to him about doing one in Spanish about ministering during these times. So we'll be doing that in multiple languages. So thank you again. Everybody be blessed, stay safe, wash your hands.
Yes. All right.
All right, thank you.